Now, at 7:30, children and young people with mental health difficulties are apparently lacking access to care.
Well, it comes as a new study reveals that 67% of young people have had at least one emotional disorder, such as depression or anxiety, but only 12% of them were ever diagnosed.
Now, of those referred to mental health services, only 43% of those referrals were successful.
Well, this begs a question. Are young people facing an unprecedented mental health crisis? Are they struggling to get access to these services? Or do we simply have a generation that can't cope?
All right, let's talk to political commentator Peter Barnes and political commentator from Young Voices UK, Noah Khogali. Good to see you both this morning. Peter, what do you think? Is this a crisis or is this people just not coping?
Oh, it's definitely a crisis because the main problem is that these people aren't going into the workforce. You know, we're seeing such a contraction of productivity already with so many people going through these mental health issues. You know, they're not joining the workforce. Some even in their lifetime. There's a case of a 21-year-old who was signed off for life from having to work over a telephone call. So there is a real line to tread here when we talk about this stuff because there are genuine cases and we have to stress that. But we seem to have developed a culture in which all risk has been removed. So I don't blame young people for being in the situation that they find themselves in. I blame the parents for this. You know, when you take out risk, you take out the chance to gain resilience. So when you have things like non-competitive sports days, when everybody gets a participation trophy, you know, these kind of everybody gets a turn, you know, it's not the real world, is it? So when you actually enter the workforce, when you have to start competing, people haven't been prepared for that at any stage in their life, not just at schools and education, because that's the quick and easy thing to blame. Oh, it's just all these teachers and, you know, spoon feeding. There is so much more at play here. And I do think that young people get a lot of the blame for a lot of the problems in the country. And I think that's wildly unfair. You know, they don't, yes, they definitely need to kick up the proverbial, some of them for sure. But I do think that we kind of box them off as all lazy and a bit snowflakey and all this kind of stuff, when in reality, they have to deal with some very difficult issues that I know my generation didn't really deal with, and many people's generations certainly didn't deal with. So, you know, we kind of left them without any kind of armor in a very dangerous world, I'm afraid.
Noah, what do you make of it?
We need to be really honest about what the statistics say here, I think. And the statistics make it very clear that, since 2017, there's been a 60% rise in the NHS saying that young people have probable mental health disorders. And there has also been a rise in suicide numbers. Those are very real statistics. And that's not a matter of, you know, people being snowflakey or whatever. Those are very real people that are facing very real problems. Now, as to why those problems are there, that's much more complicated. I imagine part of that is probably the pressure of social media in an increasingly connected world. And part of it is you know, possibly the legacy of COVID. But these are very real issues, and we need to be honest and encourage people to speak about them, or else those suicide statistics will just get worse and worse, especially among men.
But Peter has got a good point, hasn't he? Because some of these very real conditions you talk about are things like anxiety and depression and feeling down, low mood issues, which are, it's not to say they're not real, but are young people suffering from them more because they've not had a level of resilience and real world life built into their experience so far?
Anxiety and depression are fundamentally real medical issues, though.
Yeah, no one's disputing that.
Mm. No, but some people are, and I think there's a difference. I think where people assume that all mental, disorders and mental health challenges are entirely self-diagnosed, and that's not necessarily the case. And I think especially when we have this conversation, the impact on young men who then don't speak out, and then suicide is the leading cause of death amongst young men, for example. That is an absolutely abhorrent statistic, and something that we all as a society need to tackle. And we need to be, we need to not decide that the only way to deal with this is to not send them into the workforce and not try and grow and work on those issues. That's not helpful either, and that tends to lead to a spiral, and that's not something that anyone wants. But what we do need to do is work together as a society to make sure that we can, provide the support that young people need to ensure that they then can go into the workforce, can be, healthy, contributing members of society. That's the end goal that we should all be working towards, not trying to say that it's not an issue at all.
Peter, last word to you.
Yeah, I happen to completely agree. But I think one of the main things we actually have to do is provide a society in which people want to prosper in. And actually, we have a society that allows people to prosper. One of the main factors I think that is a huge driver of this is the unemployment rate that is absolutely out of control amongst the young generation. But that's mainly driven by the fact that they've been underprepared by the education system. They've kind of grown up in an economy that has basically been anemic at best, and yet the jobs that would be naturally there for young people, generally hospitality and retail, are disappearing quicker than you can say the words because of the decisions made by successive governments and what we're going to see later on this month with Rachel Reeves and further decimation of the economy. We have to get a grip of that, because you want to tackle all the kind of men's mental health issues, you want to tackle radicalization, all this stuff. It is the economy, because it's the economy that gives people drive, it gives people focus, and it gives people a sense of belonging because they're not panicking. And that's that kind of sense of economic instability is a main driver, and we've got to stamp that out.
OK, Peter and Noah, good to talk to you both this morning. Thank you.